additional doses because it would help us to provide a significant coverage, a greater percentage of our population in terms of vaccination against this virus.
And just to note that St. Kitts and Nevis is also paying forward, and we are going to assist the government and people of Grenada by donating 2,000 of those 20,000 to the people of Grenada. And so once again, we just want to thank the government of India, and remember, don't wait, vaccinate.
Is on.
Good afternoon and welcome again to another National Emergency Operations Center COVID-19 briefing for the 28th of May 2021. We thank you very much for joining us for this briefing today. I want to recognize with us the Prime Minister, Dr. the Honorable Timothy Harris. I also recognize our Minister, who is the co-chair of the Disaster Mitigation Council, the Honorable Wendy Phipps. I thank all of you for joining us as we continue to update you on what is happening in St. Kitts and Nevis with respect to the management of the COVID-19 pandemic. Today I would like to call first our Chief Medical Officer, not our Chief Medical Officer, I'll call the Medical Chief of Staff, Dr. Cameron Wilkinson, to make his presentation.
Thank you, Lesroy. Abraham Lincoln said, and I quote, "I am a firm believer in the people. If given the truth, they can be depended upon to meet any national crisis. The great point is to bring them the real facts." End of quote. We have been bringing you the facts based on the evolving science of this pandemic for over a year now. I am very happy that the people of this blessed federation have listened to the facts about the virus and have acted. First, in the all of society involvement in containing the deadly virus with the prescription of non-pharmaceuticals. When the vaccines arrived, you listened as we launched an extensive education program and then began to come in, rolling up your sleeves to be vaccinated. You did this not just to protect yourself, but also to protect those who cannot be vaccinated. I am very happy that as of yesterday, 55.8% of adults over the age of 18 did the right thing and received their first shot. And 21% of adults over the age of 18 are now fully vaccinated. These numbers will continue to climb as more and more persons are following the facts and science and coming forward voluntarily and getting vaccinated. I want to urge everyone to continue to remain focused, continue to educate yourself, Continue to protect yourself and your loved ones, and we will get through this together. The recent cluster of COVID-19 cases we're experiencing is our first, and it served as a wake-up call for many. I want to let you know, however, that it will not be our last. As long as the virus remains circulating globally, it will keep coming once our borders are open. We are going to have to learn to live with COVID-19 for some time, but make sure we are protected, especially from severe disease and death, through vaccination. We can also help to decrease the spread of COVID-19, as the science is now showing that you have a 63 to 83% risk reduction of contracting COVID-19 through vaccination. We need to continue to prepare for this attack and the next by having as many persons over the age of 18 vaccinated. Let us continue to protect ourselves and our school children and the elderly and frail. So many parents have called me, some in tears and fearful, as the current situation with the cluster involving school children and adults unfolds. We will continue to keep you in your prayers, but you can be assured that based on the history of this virus, all the children should recover and do well. As adults, you can protect yourself by getting vaccinated, along with the continued use of the non-pharmaceuticals that kept us safe over the past year. The results returned yesterday from testing was great news, as of the more than 570 persons with significant contacts tested, all 570 plus tests were negative. These results point towards containment of the virus. We will continue to widen the web of contact tracing to encircle and contain this deadly virus. We should expect to get more positive results, meaning finding more positive COVID-19 cases as we continue our contact tracing exercise. We will have a clearer picture of where we are 14 days out from the start of this cluster. We will continue to do all in our power to break the chain of transmission and get a cap on this spread very soon. Some persons have been expressing concerns re the dosing interval for the vaccine being administered, as we were using a dosing interval of 10 weeks, but have now readjusted this for some. And there are a few points you need to know about the vaccine and the vaccine doses. The vaccine is given in 2 doses. The minimum interval is actually 28 days. The dosing interval recommended by the manufacturer is 4 to 12 weeks. The World Health Organization recommends its use between 8 and 12 weeks. The efficacy after the first dose is 76%. The efficacy climbs slowly up to 82.4% after the second dose. The longer the dosing interval is associated with a higher efficacy, and the highest efficacy is seen when it's given 10 to 12 weeks after the first dose. There is, however, absolutely no health risk to persons having a shorter dosing interval, that is between 4 and 10 weeks. Many countries throws an interval of 8 to 12 weeks. We chose 10 weeks initially. To increase the number of persons benefiting from the first dose, with vaccine shortage globally, some countries have even extended their interval to 16 weeks to ensure that as many persons as possible get one shot. In countries at risk of having these life-saving vaccines expire, they have shortened the dosing interval, but not below 4 weeks, to make sure that all persons who got their first shot get fully vaccinated. In a pandemic with a deadly virus, having 76% protection from just one jab is better than no protection at all. Again, we have reached too far in this fight to lose the gains we have made. A lot of us have been working around the clock to keep you safe. We will continue in this fight. Let us continue to work together and not get complacent. And this, of course, requires your assistance. We need the assistance of everyone. And so I ask you again, go out and get vaccinated. Continue to wear your mask, hand sanitizer, and social distance, and avoid mass gatherings. We will get through this together. I know the weekend is coming up when persons tend to go out and party and fet. I ask you to do the right thing this weekend and try and avoid mass gatherings so we can contain this spread. I thank you.
Thank you, Dr. Wilkinson. I now invite our Chief Medical Officer, Dr. Hazel Laws, who would present us with the Health Emergency Operations Center Situation Report.
Thank you, Mr. Williams, and good afternoon to everyone. This afternoon, I will share with you the Health Emergency Operating Committee's Situation Report for today, Friday, May the 28th. Within the last 12 hours, the Ministry of Health received positive results for 4 additional cases. These 4 individuals are all nationals. These cases are linked to cases we reported recently. So at present, the Federation would have announced 68 confirmed cases, 54 cases from St. Kitts, 14 cases from Nevis. At present, we have 23 active cases. So the Ministry of Health, we are monitoring 23 active cases. 45 cases are fully recovered. Ladies and gentlemen, the virus is back. It has been reintroduced into our federation. We are presently trying our very best to contain this cluster of COVID-19 cases. So at present, we have 23 active cases, and as you realize, this cluster is gradually expanding. Our aim is to flatten the curve and keep the total number of impacted individuals to its lowest. And we are doing this through contact tracing. Those cases that are identified are placed in isolation so that they do not spread the disease. Their contacts are placed in quarantine to observe for the onset of the disease. We are testing all contacts, and we are also conducting targeted testing. What is contact tracing? It's the process by which we identify, evaluate, and manage persons who have been exposed to COVID-19, persons who interacted closely with persons who have been identified as positive. This is a scientific process, and it has been proven to break the chains of transmission of the virus. The Ministry of Health continues its robust contact tracing. We started this last Wednesday, and again, the aim is to identify, quarantine, isolate, and test all possible contacts of recent cases. Last weekend, Saturday and Sunday, we went into the Sandy Point Primary School. A total of 128 students were tested. By Monday, we went to the Charles E. Mills Secondary School. A total of approximately 128 students were tested. These 256 students, along with their households, have been asked to self-quarantine. 256 students and households have been asked to self-quarantine. Thank you. By Wednesday of this week, the Ministry of Health, we went to the Washington Archibald High School, the Bastia High School, the Seventh-day Adventist Primary School, and the Tyrrell Williams Primary School. A total of 441 students were tested. Now, at these 4 institutions, the students, and only the students, have been asked to self-quarantine. The recommendations we've made to the household is as follows. The household members are asked to adhere strictly to the COVID-19 prevention and control measures. So we are asking the parents, the guardians, the other relatives who live in the house with these students to wear a face mask at all times. And if and when you're interacting with the child, make sure to sanitize your hands before you do so and after doing so. These measures will help to prevent the spread amongst the household members. So ladies and gentlemen, over the past few days since we've been trying to contain this cluster of cases, approximately 760 persons have been touched. 63 of these individuals are in isolation and quarantine at a certified hotel or a government certified facility. So the 23 active cases are included in the 63. 697 persons have been asked to self-quarantine. So a total of 760 persons have been impacted by our contact tracing process. The Ministry of Health continues with its testing. So we are testing contacts. We are also conducting targeted testing, those individuals who may be associated with contacts. Just yesterday alone, that's Thursday, May 27th, we processed 570 samples, and the results all returned negative. The contact tracing process continues until we would have contained this cluster of cases. We continue in terms of administering the AstraZeneca Oxford vaccine. Please note that once you are fully vaccinated, you will enjoy an 83% risk reduction in terms of your ability to contract COVID. So in other words, once you're fully vaccinated, your risk of picking up the disease is extremely low. Your risk of transmitting the disease is also reduced. Your risk of becoming moderately or severely ill is significantly reduced, and so is your risk of dying. Dr. Wilkinson would have explained the dosing interval, and so based on the instructions from the manufacturer, and we also need to note that this vaccine has been approved by the WHO, and so WHO would have approved the dosing interval. So the two doses can either be given 1 month apart, or as the interval can be as long as 12 weeks or 3 months. Data at the end of work day yesterday. So up to yesterday evening, we would have administered a total of 25,347 vaccine doses, 19,167 in kits, 6,180 in Nevis. In other words, 56% of the target population has been covered with the first dose already, and as much as 21% of the target population has been covered with the second dose. And so this is very good, given the fact that we started our program on the 22nd of February. Now, last year, March, when we announced our first case, we went into a lockdown. This year, now we are impacted with this second wave of infections. We have to reflect on the lessons that we have learned. Now, COVID-19 has left a huge impact on us in terms of economically, socially, psychologically. It has impacted our children. And even with this second wave, it's impacting our children even more. However, the results we get or we continue to receive will dictate the way forward. Recently, these statutory rules and orders have been announced. So at present, our schools are closed for 2 weeks. At present, there is restriction in terms of public transportation. Superintendent Cromwell Henry will speak more to this. There are restrictions in terms of contact sports. There are restrictions in terms of movement. So at nights, there's a nightly curfew between 11 p.m. and 5 a.m. daily. And there is a restriction on inbound travelers, inbound regional and international travelers who are now expected to submit proof of full vaccination as of tomorrow, May 29. Please note citizens and residents are exempted. I also want you to note that all inbound passengers must still submit results of a negative RT-PCR test done within 72 hours of travel. We continue to adhere to our usual and our regular health and travel protocols, whereby upon entry into the Federation, all inbound passengers are screened at our health station, and it's only those individuals whose test is not up to standard would we test on arrival. All inbound passengers automatically go into quarantine, and they are tested while in quarantine and at the end of their quarantine period. So we do not test all inbound passengers upon entry. However, all inbound passengers go into quarantine. They are tested while in quarantine and at the end of their quarantine period. And we've been using these protocols for 6 months, and it has been serving us quite well. Please remember the essential public health measures of wearing your face mask. As I said before, this has been reintroduced into our federation. It's a microscopic organism. You cannot see it. And so in order to protect yourself from it, you must wear your face mask. Once you leave home, at the beginning of every day, once you're out in the public domain, you must wear your face mask to protect yourself from this small microscopic organism. Maintain good hand hygiene and make sure you are adequately distanced from individuals as you go about your daily activities. Avoid crowds and events. Protect yourself. Do not wait, vaccinate. I thank you.
Thank you very much, Dr. Laws. I now invite Superintendent Cromwell Henry to make his presentation.
Thank you, Mr. Williams, and a pleasant good afternoon to all listening this broadcast via whatever means. Today I will address an issue that has become somewhat controversial. It is the issue of the reduction of the carrying capacity in public service vehicles. I must first indicate that this is a public health measure and it's for a limited time in the first instance. And it is to allow for the investigation by the Ministry of Health and to contain the virus that is seemingly spreading at this time. Public service vehicles have been implicated as one of the mode of transport for infected persons. Therefore, it has become necessary that we take precautionary measures to protect users of this service. Several protocols have been in place over the last year to protect drivers and their passengers. Sadly, these protocols were ignored by many persons. The new COVID-19 Prevention and Control Order merely limits the number of passengers that are permitted to half of the carrying capacity and re-emphasize the mask wearing and sanitization protocols that has been in place all along. The carrying capacity is determined by the number of passengers the vehicle was registered and licensed to carry, which should be displayed in a conspicuous place inside the vehicle. This number does not include the driver. It is important to note that the Vehicles and Road Traffic Act stipulates that 2 children under the age of 12 years makes 1 passenger. So a simple way to determine what number of passengers you should be carrying is to look at the number of passengers your vehicle is licensed, the number of passengers that is displayed in your vehicle, and divide that by 2, 50%. So if you're licensed to carry 14 passengers, at this time you're only permitted to carry 7, and that does not include the driver. So the 7 passengers plus the driver, you would get 8 persons on that vehicle. So the number of passengers that you are permitted to carry is half of your normal carrying capacity. We therefore appeal to bus owners and operators to cooperate with the health authorities as they work to prevent the control and spread of the coronavirus at this time. You can do your part to ensure that we return to quicker normal operations by getting vaccinated and encouraging your passengers to do likewise. As we go through this weekend, I wish to remind everyone that the nightly curfew continues under the authority of the Public Health Restriction of Movement Regulations. Again, this is another public health measure designed to control and prevent the spread of the virus by limiting the time and opportunities for social activities that may facilitate such spread. Therefore, from 11 p.m. nightly until 5 a.m. the following day, until June 8th, all persons are required to be at their residence unless special permission is granted by virtue of your employment as an essential worker or for medical or other emergencies, or unless, of course, you receive permission in writing from the Commissioner of Police. We appeal to bar owners to ensure that you cease operation in sufficient time to allow your staff and patrons to be at their residence before the curfew time. Those persons who have received electronic curfew passes are reminded that these passes should only be used in the course of your duties and should not be abused. Any abuse of the privilege will result in the revocation of the passes and possible arrest and prosecution. Similarly, persons found away from their residence during the curfew time without permission runs the risk of being arrested. Regulation 5 of the regulation provides for severe penalties for breaches. A person who contravenes or fails to comply with these regulations shall, on summary conviction, be liable to a fine not exceeding $5,000 or to a term of imprisonment not exceeding 6 months, or both. We therefore solicit your fullest cooperation as we work together to ensure that we get through this period safely. Thank you.
Thank you, Superintendent. I now invite the manager of the Water Services Department, Mr. Cromwell Williams, to make a presentation.
Good day, citizens and residents of St. Kitts and Nevis. My name is Cromwell Williams, and I am the Manager Water Engineer for the St. Kitts Water Services Department. Today I have requested the kind permission of the National Emergency Management Agency, NEMA, to be here to address you. Because while we're all aware of and are focused on the COVID-19 pandemic, 99% of us are unaware that we are also facing another emergency. I speak of the unavailability or scarcity of water due to the current drought conditions or prolonged lack of rainfall. Data obtained from the Met offices indicates that for January to April of this year, we have received only 6 inches of rain. Last year, for the same period, we would have received 12 inches, twice as much. The normal average this period is 15 inches of rain. May is almost finished, and we have had 0.6 inches of rain for the month so far. Normally, May brings a break in the dry season with about 4 to 5 inches of rain. By all standards, this is a very serious dry season. It is not only St. Kitts. The Caribbean Climate Outlook Forum of the Caribbean Institute of Meteorology and and Hydrology has recommended that a drought warning be issued for St. Kitts and Antigua. Let me make it abundantly clear, my fellow citizens, that all of our water comes from rain. At the Water Services Department, we understand that our mandate is to develop adequate water supplies to meet the need of a rapidly developing country. Indeed, we have come a long way in this regard over the past 2 to 3 decades. We have drilled wells all over the island. We currently have almost 30 wells in operation, producing about 5 million gallons per day. Our strategy for meeting future demands for water was always well planned out. We would continue to drill additional wells, and eventually we would have to turn to desalination to augment our supplies. Desalination, which is the conversion of seawater into drinking water, is a last resort, as it is at least twice as expensive as our normal sources of water, seeing that it uses quite a bit of electricity, and we know that electricity is not cheap. Unfortunately, over the past few years, we did experience some setbacks in our well drilling program, but we are back on track. We have recently signed a contract with BEAD for rehabilitation of a well in Shadwell, as well as the drilling of new wells starting in the Keon area. This dry season has opened our eyes to climate variability, and hence we can no longer delay our turning to desalination as a means to augment our public water supply. Once the rain starts falling, hopefully in July or August, we would have adequate supplies. And had it been less dry, we would have had adequate supplies at this time. However, what we are seeing currently is far below normal rainfall. We have already resorted to trucking water in some areas. Let us remember that we do not make water. We capture it and distribute it, and there are limitations. So today I am appealing to all of us to come to the awakening that we are in a drought and we cannot continue to use water as we normally do. Let me preempt those who would say that the Water Services Department is the biggest waster of water, because it seems that we sometimes take an inordinate length of time to address leaks, etc. Yes, we do have limitations. Yes, we do have limited resources, and hence sometimes our response time might not be what it ought to be. However, this in no way justifies you not being willing and diligent in playing your part to conserve what little water we have. What we desperately need in St. Kitts is a paradigm shift when it comes to water, a whole new mindset. With all the developments that have taken place and are taking place, we can no longer see St. Kitts as a place that has a lot of water and where water is cheap and can be wasted without consequence. We must see St. Kitts as a place, yes, where the government is prepared to subsidize the cost of water to ensure that the ordinary man can afford to pay for the water that he needs for health and hygiene, but persons who want to fill their swimming pools and have their grass green even during this dry season must pay the true cost of providing the service. In fact, I must say that perhaps the most significant deterrent to this paradigm shift, to our customers taking water conservation serious, is the fact that water is so cheap. People do not value what comes cheap or easy. So, as we go through the remainder of this extremely dry season, and even all year round, I am beseeching you to conserve water. Show your love for your neighbor by using less water. A few tips: check your toilets and your premises for any leaks and have them repaired immediately. Report any suspected leaks to the Water Services Department. You can reach us at 467-1005 or 467-1447. Do not water lawns. Do not use hoses to wash vehicles and buildings. Use a bucket. Use your rinse water to water your garden. Persons who have cisterns should start using them, and persons who do not have should look at investing in the purchase of some storage containers. Generally, monitor your use of water and be as conservative as practicable. The cooperation of all is greatly appreciated. Thank you.
Thank you so much, Mr. Williams, for that very serious message of water conservation during this period of drought. I now invite the Chair of the National COVID-19 Task Force and National Disaster Coordinator at the National Emergency Management Agency, NEMA, to address us, Mr. Abdias Samuel.
Thank you, Mr. Williams, and a pleasant good afternoon to all my colleagues and also to all the viewers here present. Today I want to update you on the work that is being done in support of the national response to this outbreak. I want to highlight the work of the Ministry of Social Development and Gender Affairs, led by Permanent Secretary Janelle Lewis and her team. Today they would have reached out to 88 households, meaning they would have contacted them via telephone, and we would have reached a total of 114 persons who are in isolation and quarantine. However, today they would have delivered care packages to 24 households around the island. At this time, I want to pause and thank a number of persons who would have supported this initiative. In particular, social services officers, home care officers, community officers, drivers from the Ministry of Education, and the donors who would have donated to this cause. Mickey's Hope Foundation, who would have provided 34 care packages and have 60 more care packages to bring to the agency tomorrow to be delivered. Tomorrow it's our effort to deliver to some 60+ households so that everyone can be reached. We also want to thank Ras Tuba, a farmer from Lodge, who at the last briefing when we made the clarion call for assistance would have contacted PS Janelle Lewis and would have donated a bag of onion. I think it's about a 50-pound bag of onion. Thank you, Ras Tuba. Equally so, we want to thank Ross University for the kind donation of water for these persons. Dr. Cheryl Rosen, who would have donated 1,000 EC dollars in shopping, and also Sugars for their also kind donation of money for shopping. I also want to highlight the work of the Catholic Church in Sandy Point in providing cooked meals, and also the Moravian Church, who will also be participating in this social effort. To students who are returning from overseas to St. Kitts, I am appealing to you to seek your reservation or booking at the OTI hotel if you are seeking a waiver from quarantine. At the present moment, we will facilitate you at the OTI hotel only. So if you are seeking for a waiver from quarantine fees, please email the COVID-19 Task Force at gov.kn. Let me emphatically state that these applications will be dealt on a case-by-case only. You can also call the 762-0238, and this number is also WhatsAppable to make your booking. I have been asked several questions regarding a notice that has been circulating from SCASPA regarding the ferry terminal. And the question is, do I have to be vaccinated to travel between St. Kitts and Nevis based on what is outlined in the notice? Let me report to you that I have contacted the CEO of SCASPA and also the chairman of the board of SCASPA, and they have indicated that no citizens, residents, visitors traveling between the island will be required to have a vaccine in order to travel between both islands. So there may have been a misinterpretation of what was being said. However, please note that the non-pharmaceutical measures will be enforced at the ferry terminal. Ladies and gentlemen, our containment strategy is very simple and clear. And my colleagues before me would have outlined a number of strategies. We clearly stated in the beginning that the outbreak will require contact tracing, which we would have heard the CMO speak to it, quarantining and isolating, mass testing, enforcement of the COVID-19 protocols, risk communication, which we are doing today, review and strengthening of our protocols in general, monitoring, evaluating, and reporting, education and training. And a key tool that we are asking you to use in order for us to combat this pandemic is vaccination. Those are the key points that we are using in our national containment strategy against this particular outbreak. So citizens and residents, we want to continue to commend the hard work of the frontline workers who are inoculating, contact tracing, who are also testing individuals, the officers who are on the ground also enforcing the protocols, those officers from various arms of the government who are providing the social support to the individuals who are in quarantine, and those who are calling to ensure that these individuals feel safe. We want to say a hearty thank you to you, and I also want to thank the Honorable Prime Minister and his cabinet for supporting these social efforts and interventions. This is a comprehensive response to the outbreak that we are now facing. However, I must highlight that Mr. Williams would have also added an additional hazard that we are facing. We have spoken about the dual hazard impact that we may face as the hurricane season starts in a few days. We now have another hazard, and that is of a drought. Citizens, we need to be prepared for this situation. We are a small island state, we're a twin island state, and our resources are minimal. Let us manage our resources carefully. With that said, please have a safe weekend, and I am seeking for all of our citizens and residents and visitors alike to ensure that they adhere to the COVID-19 protocols and cooperate with the officers who are doing their job. Thank you very much. And for those who did not get the care packages, I have been receiving calls about what happened to me. We are going to reach out to you tomorrow. We have 3 buses from the Ministry of Education that will be strategically placed throughout the island, and they will be carrying out these care packages to you. We will reach out to you by tomorrow morning thereabouts. So have some patience, and we will get to you soon. Thank you. Mr. Williams.
Thank you very much, Mr. Samuel. I would now invite the Prime Minister, Dr. the Honorable Timothy Harris, to make some remarks.
Thank you very much, Lesroy. I want to recognize our Attorney General, Mr. Vincent Byron, our Senator, Minister Wendy Phipps, of course, the High Representatives of the Ministry of Health, led by Dr. Laws and Dr. Wilkinson, Mr. Henry, Dr. Carty, and all others who are here. And really to start on a note of commendation to these, our very faithful public servants, ably led by our Attorney General in discharging the mandate to keep our country safe in the context of the COVID-19 ongoing war that we are doing here. I want to thank them and to say that the country is eternally grateful for your excellent service, for your sacrifice, dedication in this long battle we've been waging before March, but certainly since our first cases took place of March 2020. I must publicly thank the Attorney General because he has been most present and his leadership felt in guiding the task force through the many challenging cases that would have come and the many other interventions he had been able to give and to provide steady leadership of those activities, ably supported by Senator Phipps. We owe them all a debt of gratitude. We continue to do this war, and in the war we will have battles which we must win, but ultimately winning the war is critically important. Over the last week, we have come to realize that COVID-19 is still here, and that COVID-19 requires all of us to be on alert and on guard. The response to COVID-19 is still an all-of-a-society approach. Every individual must share the personal responsibility or take the personal responsibility to keep himself or herself safe and, of course, their family and their loved ones. The over 700 plus persons that had been part of the exercise of contact tracing over the last few days, many of them were unsuspecting in terms of having never anticipated that they could be caught in some way with respect to the COVID-19. That is a wake-up call for all of us. Whether we are a child going to the primary school, or we are a parent, or we are nurses or doctors, it really doesn't matter. Any of us and all of us are at risk. And the only way we can reduce that risk is to ensure that all of us all of us are vaccinated. We have been saying with respect to countries that no country is safe until all countries are safe. Because COVID-19, of course, represents a transboundary challenge. To the extent people move and people cross borders, COVID-19 is everywhere. Equally within our household, we must ensure that everyone is vaccinated. In our schools, we must ensure that every teacher is vaccinated. In our health centers, we must ensure that every health professional is vaccinated. In our security forces and all our frontline agencies, everyone must be encouraged to be vaccinated, because until all are, each of us remains exposed to the virus. And that in part has been one of the lessons that I hope we have learned so well over the last couple of days. I want again to commiserate with those who have found themselves in an uncomfortable place, being, as it were, identified as persons of interest or persons with the virus. The coronavirus is a disease, and we will hope that right-thinking and sensible people would provide and accord the level of protection which every individual should reasonably expect in our society. Some persons who are not even bearers of the COVID-19 disease have had their names scandalized across social media. And we must reject that as indecent, inappropriate, and unethical. And those of us who receive them on our phones must not bother, we must immediately delete them and not share them with anyone else, because we help in propagating unethical conduct by doing so. So, again, to all those who have been victim of that indecent behavior, I pray that you are able to pick up the pieces and to continue. And those of us who know better will do better, and we will do unto others what we would like them to do unto us, ourselves. The country has done and continues to do an excellent job in managing the COVID-19. We still are among the best performing countries in the containment of the virus anywhere in the world. Even as we speak, with the second wave of cases that have been confirmed, St. Kitts and Nevis is still among the independent countries the lowest confirmed cases. St. Kitts and Nevis still has one of the best record in terms of testing as a per capita of the population. St. Kitts and Nevis still stands unique, save for Dominica, as being the only country within CARICOM that has not recorded one death. For this we give God thanks. These are the gains that we must consolidate. We have come too far to think about turning backwards to complacency and, of course, getting bored of doing the right thing. This is a war, several battles. Some we must lose, or we will lose, given the nature, but we must never lose the war. In this war against COVID-19, there is only one certain weapon, and the most powerful weapon available to us is the vaccine. And we are well aware that across the majority of countries in this world, the most widely used vaccine is the AstraZeneca vaccines, which we are using here. Some time ago, someone asked the leader, the director at PAHO, Dr. Etienne, what is the best vaccines for people? And she responded rightly, the best vaccine is the one that is available. The best vaccine is the one that is available. And what is available to us is a vaccine that has been approved by the international body, most respected international body dealing with issues of public health, the World Health Organization. There are some who say they were waiting for another vaccine. They must be careful how long they will wait. This is a pandemic. And around the world, over 3 million persons have already died. In Antigua, there has been death. In St. Martin, there has been. In Jamaica, there has been. In almost every Caribbean country, it has left a trail of, and we do not want anyone in St. Kitts and Nevis to be among that statistics. Some effort to confuse, so they are waiting for vaccine. Maybe one over. Again, the ridiculousness of it. The vaccine is the one that you have. As we today, the vaccine for that has the approval of the WHO. In the face of the pandemic and the emergency of the pandemic, some people are touting the foolhardy view that people should wait. For what? When you already have the vaccine, the mostly used vaccine that is available to you. Over 140 countries and jurisdictions are using the AstraZeneca vaccine. Why wait when now is their time? Why wait when you are under the global shortage of vaccine? There is no certainty that things will be available when you think you are ready. This is how India, most generous country, has now become like the epicenter in terms of the virus. And our leads, because being so good a country in practicing the diplomacy of violence and providing to the rest of the world. And it has now found himself in a case where it required ventilators, and it required vaccine. And it was to take the decision that priority given to its own citizens and residents before it allowed export of that product. That is the reality that we face. That is the reality that we face around the world. Supply chain issues. To the news out of Europe, governments are saying they will take a company to court to ensure that it delivers to them than delivers. The CARICOM region recognize that we do not have the of effective purchasing power. Our numbers are small, and therefore supplier will not tarry with a small order when he gets a large order that makes sense. And so I want to end by again congratulating all 55.8% of those who have gone forward and done the right thing, done it for themselves, offering themselves to protect, but most importantly, do it as an selflessness, doing it for their family members, doing it for the children who can't be vaccinated at this particular moment in time, therefore have to give them the protection. So if you're a mother or a father, I appeal to you to vaccinate. Get vaccinated now, and that comfort and protection to your trial. I want to make a special appeal to taxi operator. Now is the time to do it. I want to make the appeal to every operator of the bus. Now is the time to do it. And yes, some say that the busmen would have preferred that there was not a 50% reduction and that they could have, as it were, have a better life. During the pandemic, the livelihood is important. It's about saving lives. We must make the point. If there is no life, there is no livelihood to worry about. So you have to make sure you are healthy and well enough for the job. And that is what the restriction of 50%, not new, is intended to do. It is to save your life. It's to minimize the risk of the other passengers who are on the bus. 50%, half a loaf. I grew up grandmother and she would have reminded us many times, half a loaf is better than none. And if it means saving the life, halting the transmission of the virus, we should willingly do that for a period of time, 2 weeks in the first instance. I wish that every person taking would be vaccinated. Then we won't have to bother with nothing, because the risk there would have been brought to zero, because everyone would have been fully vaccinated. So it means if you can get more of your passengers, we will be able to make the necessary adjustment. I want the appeal to all these officers, our fire officers, prison officers. Do not take ignorance. Do not test faith. God has been good enough to bless us. This February 20, we said only effective response would be the vaccine. God has helped. Vaccine. And over the world, over 1 billion people have moved to get themselves vaccinated. You must ask yourself, if you have not yet gone, why are you opting out? Does it make sense to you to opt out, to test faith, to put your life in risk? So in closing, the Cabinet's priority is to keep the people of St. Kitts and Nevis safe. We regret that in this effort to protect us, there have been some suffering and some pain, and several persons have been put out of work. There's only one tool we have in our arsenal. Well, I should say and remind, the most powerful tool is the vaccine. Help us put the country back to work again. Help us open up more fully to the sports and the entertainment industry. We want that for you because we love and we care. The only way we'll be able to do it effectively if enough of us are vaccinated. Again, heartiest congratulations. We have had several successful days of record making, where persons understanding the urgency of now have gone out to be vaccinated. I hope that today, Friday, when the tally is done, we would also have had a very good day. May God continue to bless the people of St. Kitts and Nevis and to keep us safe. Let us ask Him for wisdom if we are still in doubt about the vaccines. And He will tell you, go do it now. We are in a danger zone. This is a war. And I remember last year, I used the analogy of war because that is what it is. And that is what it will continue to be. It is a fight for survival. And we can win it, and I am very hopeful that we can. Again, congratulations to all the people who have been working. Congratulations to those who, a few minutes ago, Mr. Samuel announced, were making donation of care packages and giving all kind of wonderful considerations to those in our front line. Working together, we will overcome, and we are overcoming this challenge. Again, thank you very much.
Thank you very much, Honorable Prime Minister. That brings us to the question and answer segment. And the first two questions, I would ask the Attorney General to open the batting. He often likes to speak about cricket, and I think he was a cricketer. Will people have to be vaccinated to use CASPA facilities effective June 1st, 2021? The AG recently stated it was inadvertently published and not approved by the Cabinet. Has that policy been approved, and will it take effect from June 1st? That's the first question. The second one, can you set the record straight on social media posts that alleged that several top government officials, including the Attorney General, Vincent Byron, have tested positive for the coronavirus?
Thank you very much, Lesroy, Chair. And I would want to respond to the second question first, although maybe the medical experts might have been better able to answer that. No, I have not been tested. No, I have not been diagnosed with COVID-19. And as far as I know, no one has informed me that I have been a contact of anyone who has been recorded with the COVID-19 virus. So that the popular phrase, fake news, is best attributed to this myth that the Attorney General, and I understand too, members of my family, have been quarantined with coronavirus, COVID-19. I'm in good health. My family is in good health. And I thank all of you for your prayers to keep us healthy. And we wish to pray for all of us in Sengis and Nevis at this point in time. So I hope I put that to rest. In relation to the issue of a notice that has been put out by CASPA, I said on Wednesday that the Cabinet has not made a decision on this post, on this notice. And it's important to understand how we in the Cabinet have had to manage this issue of the coronavirus. The Honorable Prime Minister last year created and asked us to form a national COVID-19 task force. In that task force was a wide cross-section of public servants, civil servants, senior public servants who come together to address issues related to the COVID response. Primary in that list is the Chief Medical Officer and the Medical Chief of Staff. And we rely on their medical expertise and that of a very critical and important body that they lead in relation to the Ministry of Health, that's the Health Emergency Operating Center. They deliberate, they discuss the medical science, and they come to the task force and give their recommendations, their advice. There are other issues that ultimately arise from some of the recommendations. how do we contain movements? How do we have a corridor of containment for people to come in? Quarantine, security, foreign affairs, the Ministry of Tourism, and I can go on and on. The Commissioner of Police, the Commander of the Defense Force, are all part of the task force. And we deliberate on all of these matters, and recommendations are made from the task force. And it's at that point we invite representatives of the task force to come to the Cabinet of Ministers of the Government of St. Kitts and Nevis and give us their best advice on these recommendations. And we at Cabinet deliberate and make decisions, which I'm happy to say, over the last year and more, we believe have been very successful. We had a state of emergency that lasted to the end of the last year. In some quarters, this was criticized. It was even tested in court. But we prevailed, and we know that this was successful. The Cabinet of Ministers meets regularly, and there are a number of issues that are discussed relevant to the coronavirus. We believe that we have the best interests of St. Kitts and Nevis at heart, and as the Honorable Prime Minister stated early, keeping our people safe is our number one priority. Keeping our people safe is the number one priority. We know, the country knows, that the number one recommendation over the past year has been to adhere to non-pharmaceutical protocols. The wearing of the mask, sanitizing our hands, social distancing, physical distancing. We try to avoid mass gatherings. And this will help to keep us safe. Intuitively, if people cluster around you, you drift away. You ensure when you come into contact with people, you have on your mask. But, as the Prime Minister said, and we get this from solid medical advice from the Chief Medical Officer and the Medical Chief of Staff, our last and most important tool at this point in time is the vaccination. We hope everyone in St. Kitts and Nevis who can be vaccinated will be vaccinated. And we have laid it out for you on many occasions. We say that we want to get 70% of our population vaccinated, and that amounts to 18 years and over. And I want, like the Prime Minister before me, to commend the Ministry of Health, our medical teams, because we are at 56% right now. We are getting there. It is the most positive achievement. But we cannot rest on our laurels. We have to continue to do so. And so, we come to the notice. As I understand it, the notice asks that people who do business with the Ports Authority and who visit them for one reason or the other should either be vaccinated or have a negative PCR test. This is a recommendation from CASPER, the board at the Ports Authority. And it is one that the Cabinet has had sight of and will continue to deliberate and will confirm it or adjust it, make recommendations when we meet on Monday coming. I wish to point out to all that the supreme law of our land is the Constitution of St. Kitts and Nevis. And that law allows Parliament to make laws for the good governance of our country. We in St. Kitts and Nevis, our Parliament, has passed a law, the COVID-19 Prevention and Control Act 2020, that establishes how the COVID response should be. And if you bear with me, I would like to just maybe read one or two of these clauses of this act. Part 2 of this act speaks to the administration of the fight against COVID, the response. And Section 3 speaks of the Chief Medical Officer. It says the Chief Medical Officer has ultimate responsibility for the management of the public health response to COVID-19 on the island of St. Christopher and on the island of Nevis. Subsection 2 of that says, pursuant to the first section, all national decisions related to the public health management and response to COVID-19 shall be in consultation with and subject to the approval of the Chief Medical Officer, who shall have the final say in respect of these decisions. 3, all health officers and other relevant officers shall, in the exercise of their powers and in the performance of their duties under this Act or other related legislation for the management, control, and response to COVID-19, act under the general and specific directions and control of the Chief Medical Officer. And 4, the Chief Medical Officer shall liaise with and report to the National Emergency Operating Center once it has been activated for the purposes of COVID-19. Our medical technical expert, the chief medical person, is the one who has ultimate responsibility for determining decisions that we speak of. I want to look at subsection 4, and that is the National COVID-19 Task Force. Subject to the provisions of Section 3, related to the Chief Medical Officer, the National COVID-19 Task Force is responsible for the coordination of the national response to COVID-19. The composition of the National COVID Task Force is as set out in Schedule 1, and I won't go to that, but as I've mentioned earlier, it comprises the senior representatives of our government, our technical, our public servants who make up that body. It says that the task force may liaise and consult with such other public and private agencies and bodies as may be necessary. Chief Medical Officer, the National COVID-19 Task Force may consult and liaise with other public bodies and agencies, but ultimately, decisions in response to COVID-19 rest with the technical experts, the medical experts, and the National Task Force. This is the law of the land. The powers and duties of the National COVID-19 Task Force are as follows: to implement, pursuant to Section 3, national initiatives as it pertains to the prevention, mitigation, and suppression of the spread of COVID-19. B, to inspect or visit various facilities, including schools, hotels, guest houses, places of business, places of quarantine, places of isolation, and other relevant locations or facilities for the purposes of ensuring conformity with the provisions of this Act and any relevant laws pertaining to the prevention, mitigation, and control of the spread of the coronavirus, COVID-19. To liaise and consult with relevant public or private agencies as may be necessary. To conduct programs of public information and education on the mitigation of, preparedness for, response to, and recovery from COVID-19. To identify compliance teams to assist in its operations and to guide the public on the implementation of measures to combat the spread of COVID-19. I've taken my time to establish the framework of how the response to COVID-19 in our country works. We at the National Task Force receive advice and recommendations from our medical experts, and the public policy has been that the task force consults, gives advice to the cabinet of ministers who ultimately make decisions on the response to COVID in St. Kitts and Nevis. Now, that does not mean that private businesses and agencies or public bodies may not have their views and do so. But ultimately, the Cabinet of Ministers, ultimately, the National Task Force has oversight of these. And I must confess that it's not always that whether you're a public body or private body, that you have the full information and advice that we have. Now, as it pertains to this particular notice, I have said on Wednesday, and I say again, the Cabinet is deliberating this. I will make a final decision on this when we meet on Monday. Because there are good issues involved here, where there are those of us who feel that everyone should be vaccinated, and we urge, we encourage people to do so. But we have to do so in a manner that's reasonably justifiable in a democratic society. That's the phrase in our Constitution that underpins things like freedom of movement, freedom of association, and so forth. That they are constitutional responsibilities that we must adhere to. And what is reasonably justifiable in a democratic society, we must uphold. So that, for instance, when the Ports Authority says that everyone must be vaccinated to attend the facility, does that mean, for instance, that anyone 18 and under who cannot be vaccinated, when they attend the ferry terminal, which supports the authority, how do we take the boat to Nevis? Are there exemptions? What are the other issues involved in something of that nature? And there are other issues like this that we at the Cabinet would want to look at, guide, support, recommend, and make a decision on. And so I would say that we would want to look to the final decision before the 1st of June when the Cabinet meets on Monday. Lesoy, I hope I've not taken too much time, but I hope that I've been clear and that our citizens understand. I just want to, once again, commend our medical team on the very difficult and very public service that they do in getting us to vaccinate. 56%, wow, we're getting there. And we know that our citizens will continue to do so. We have to pray that we can get to that point where all of us can be properly protected. And once again, I want to say that I'm doing well. I do not have COVID. Thank you.
You know, there are people who are spreading information or rumors and others that they have this and they have that they have COVID or they don't have COVID. But it is not the responsibility of the NEOC to reveal medical information on anyone, as it is a breach of professional ethics. If the person in question chooses to reveal this information, it is his or her right to do so, as the Attorney General just did. But it is not for us to call names from this podium. A number of media houses have been asking, and that has been my response to them. There is another question from Win FM, which I will ask. With the current batch of vaccines set to expire, according to health officials at the end of June, when will the country receive other doses? And will health officials continue to administer the first dose of the current vaccines under these circumstances?
I want to take this opportunity to ask WinFM to use their platform to encourage every citizen over the age of 18 who can take the vaccine to go out and take the vaccine, knowing that the science has shown that the vaccines are safe and effective. We still have thousands of doses of vaccines that are here, and we need to make sure that we use every single one, because I believe it will be a travesty if such a precious and safe commodity is allowed to expire on us while persons remain hesitant. And so when we speak about the all of society approach, this is what we are speaking about. We have said repeatedly, however, we continue to work behind the scenes to secure other vaccines, but we cannot bring in a shipment and have them stored up at JNF and at the same time discarding vaccines that we have here. So let us stay focused and let us make sure that we get as many persons come out so that we can reach herd immunity. I thank you.
Thank you, Dr. Wilkinson. Next question. Mr. Dwyer Astafan recently criticized the quarantine protocols and said that we should be using the rapid tests to screen all persons entering the Federation. Can you comment on this? In other words, should we be using his advice? Dr. Wilkins.
Well, I've said here many times before that everyone is entitled to their opinion, and so anyone can say anything. But here we try to follow the facts. And so let me speak briefly about the tests that are available for COVID-19. There are two types of tests. We have the antigen test and the antibody test. I will mention the antibody test just to discard it because they are no longer really in use, especially with widespread vaccination. The antibodies test will be testing for the proteins that you develop when you're fighting off the infection or if you have immunity. And so if you were to do an antibody test on everyone who was vaccinated, it will show that you have developed antibodies. And so that would not tell you whether or not the person does or does not have COVID. Now, as it relates to the antigen test now. We have said all along that the gold standard test is the PCR test, and that is the test that we have used for our entry protocols, and it kept us safe for almost a year, giving us the lowest COVID risk in the entire hemisphere. And we will continue to do that test for our screening protocols. They have recently been developed rapid antigen test also to test for the antigen particles of the virus circulating in the nose. Now, for these tests to be positive, you need to have a high viral load in the nasal cavity or the throat when they do the testing. And what is done in this test, a swab is placed in the nose or the mouth, and it's put on a card similar to doing a pregnancy test, and you look for a color change. And so that result can come back within 15 minutes, and it doesn't require any special laboratory facilities to do that, and that's why it is called a rapid test. However, those tests are highly inaccurate in that they have a high false negative rate, which means that you can have a result coming back negative when you are actually positive, because they require a higher circulating level of viral particles in the nasal cavity for them to test positive. So what it means then is this. The accuracy can range anywhere from 48 to 78%. If somebody is symptomatic and the test is done, they have a 75 to 78% accuracy of finding the positive result in that person. If somebody is asymptomatic, that is, they have no symptoms at all, although they would be infected, it will miss up to 48% of persons who are actually positive. So you will have somebody testing negative on the rapid antigen test that is being suggested by the gentleman, but if you were to back check them with the gold standard PCR test, they would be positive. There is also a big difference between testing somebody who is symptomatic in the first week when their viral load is high, and in the second week when they're recovering and their viral load is dropping, but they can still pass the virus on to persons. And again, if you're symptomatic in the first week, using the rapid antigen test, you can pick up about 75% of persons, but in the second week, you can miss almost half of the persons who actually are positive, but that test will give you a false negative result. And so because of those reasons, we will not use the rapid antigen test for our screening at our ports. You might ask, well, why is it being used in certain places? It is used in certain places where you have crowds that are coming together, like at theme parks and entering games, etc., because the philosophy is if you can pick up 50% of the persons who are symptomatic and positive, then it will decrease the risk, in addition to the social distancing measures. But that is not something that this country will use as an entry screening tool, because we will be missing almost half of the persons who might be coming in with the virus. I hope I made it clear.
Thank you, Dr. Wilkinson. This next question is for the Chief Medical Officer. Can an explanation be given as to why the different protocols for the students tested in Sandy Point compared to the, comparing those protocols to the more recently tested students, the Washington Archibald High School, the SDA School, the BHS Bastia High School, and the Tyrrell Williams?
Mr. Williams, I thank you for that question. Very, very good question. It will provide me an opportunity to respond and to highlight the importance of vaccination for the parents of children on a whole and guardians of children on a whole, all adults in households with children. This situation brings to the fore the importance of vaccination. Now, the Ministry of Health continues to be guided by the science with respect to our recommendations and interventions. So last weekend, we went to the Sandy Point Primary and the Charles E. Mills Secondary School. 256 students were tested. They were asked to stay home along with their households in terms of in self-quarantine. Now, self-quarantine means the student and the family members remain in the confines of the house. So in other words, you're just confining everybody to the house. This protects the spread of the virus outside of the household. By Wednesday, 4 other schools were implicated: Washington Archibald, Bastia High, the Seventh-day Adventist Primary, Tyrrell Williams, an addition of 441 students. So we saw the number of schools increasing, the number of students increasing. We realized the most important recommendation is adherence to the COVID-19 prevention and control measures. The wearing of the face mask, hand sanitization. Because guess what? That prevents the spread within the household. And if you do not have spread within the household, it won't go outside the household. So in other words, the adherence to the measures protects the members within the household and outside and external to the family unit. So in other words, just saying self-quarantine is a false sense of security. So ladies and gentlemen, the most important recommendation is the prevention measures. Wearing the face mask when interacting with the child who was exposed to the positive, and sanitizing your hands, etc. Now that brings me to the best tool that we presently have in terms of fighting this virus, vaccination. Now this situation underscores the importance for the parents, all parents, to become vaccinated, all guardians, all adults with children living in their household. This tells us that you need to come on board and accept the vaccine. Because if the adults and parents in the home is vaccinated and a child comes home because the child was exposed to a case, you don't have a problem. You just put on your face mask, sanitize your hand, care for your child, and then go to work without a problem, without worrying about transmission of the virus. So I'm very happy that you asked, because it brings to the fore the importance. And so all the persons who have posed this question, I want you to help me to impress upon the minds of all adults who have children, all guardians, everybody who has, all adults with children in their homes. There's a strong case for you to come on board and be vaccinated. You're protecting yourself, your household, your child, and by extension, all who you interact with, your workplace. Thank you for the question.
Thank you, CMO. I know that people have been asking about those of us who come here to this podium and concerned about the transmission of the virus and if we are sanitizing and so on. At the NEOC, we are particularly careful. Everyone who comes to this podium has been fully vaccinated, plus every time we leave the podium, we sanitize our hands. When we come into NEOC, we sanitize. When we are not at the podium, we have our mask on. In addition to the fact, and then we have been vaccinated, fully vaccinated. And I am not a medical doctor, but I read that people who are fully vaccinated, that even if they contract the virus, the viral load is so low that it doesn't affect them in any adverse way. And the viral load is so low, almost negligible, that you don't transmit the virus to someone else. So that is a high level of protection by just being vaccinated. CMO.
Mr. Williams, one of the education officers just sent me a WhatsApp to remind me that some teachers were also implicated and tested at the Sandy Point Primary, Charles E. Mills, and some of the other 4 high schools, that were implicated on Wednesday. So the teachers also need to come on board in terms of being vaccinated. because they can be affected when we have a spread or cluster of cases like this. So I want to bring on board the teachers and the importance for them coming forward and accepting the vaccine, because some of the teachers at either of these 6 schools, they were tested and they are also in self-quarantine. So it's important for teachers to recognize why it is they need to come on board in terms of accepting the vaccine.
This question has to do with the regulations having to do with the curfew. If I want to go to the hospital after 11 p.m., what do I do?
Well, if there's some medical emergency, of course the regulation provides for you to attend to that emergency. You just need to inform the police, call the police station in the district where you live, inform the police that you have an emergency, and give them your vehicle number and indicate to them that you'll be heading to the hospital, and that will be just fine.
This next question is for one of the health professionals. What will be provided for persons who cannot take the vaccine, those with autoimmune diseases? I think one of you addressed that before, but Dr. Wilkinson.
There are very few absolute contraindications to someone taking the vaccine, and we will take those individual cases under consideration in consultation with your doctor, of course. But this is why we say those who can be vaccinated need to be vaccinated to protect those who can't. And so if although autoimmune disease in itself is not a contraindication, many different immunes, but those of us out there who are healthy and strong and over the age of 18, and even if you're over the age of 80 and fit, if you can take the vaccine, you take the vaccine, because that is what herd immunity is about, protecting those who can't protect themselves.
Thank you, Dr. Wilkinson. This question is for Dr. Laws. I believe I heard Dr. Laws say that nationals returning home are not required to show proof of being fully vaccinated, but non-nationals are required to do so. If that is so, please explain the procedure which will be used in determining the length of stay in quarantine for an arriving passenger, that is 9 days or 14 days.
All right, so it's been a couple of weeks now since we've been accepting inbound passengers who are fully vaccinated, meaning you would have received the 2 doses, if it's a 2-dose regime, if it's a vaccine with a 2-dose regime, or if you would have, if you got the 1 dose of the Johnson & Johnson. So once you provide us with the evidence that you were fully vaccinated, and 2 weeks would have elapsed between your last dose and your date of travel, you would be deemed fully vaccinated, and you qualify for a reduction in your quarantine period from 14 days to 9 days. However, if you are an adult traveling with a child, if you are a parent, a couple traveling with a child, the 2 adults are fully vaccinated and the child who isn't, because children, you know, they are not vaccinated, at least up to now. The family unit will remain in quarantine for 14 days.
This next question, since spectators have to be fully vaccinated to look at sports, will the players have to be fully vaccinated or be tested before they go on the field? That includes all referees, commentators, coaches, bartenders, and so on.
We have addressed this question many times before, and we can't put everything in the same basket. And so we have the players who practice and play in a bubble, and when they're allowed to go on the field, they play on the field. And that's a separate situation to persons in the arena and having thousands of persons in the arena looking at the game going on. And what we are saying is persons who are entering, they can create a mass gathering situation which can become a super spreader. And so we are saying that spectators, they need to be vaccinated to enter. And even when they enter, we will have them properly socially distanced, okay, which is separate to the encouragement that we are giving to all of the persons who play competitive sports to be vaccinated.
However, I feel compelled to add that based on SRNO number 14, there is a restriction in terms of contact sports. In terms of there are no person shall attend sports training or practice sessions for amateur or other recreational sporting events at this time. Beg your pardon? Oh, with the exception of the two upcoming CONCACAF qualifier matches, St. Kitts versus Guyana and Puerto Rico versus Guyana. St. Kitts versus Guyana, June the 4th, and Puerto Rico versus Guyana, June the 8th.